I think Senator Grassley has already raised the issue of bipartisan legislation that he and Senator Wyden and others on this committee crafted in order to try to reduce prescription drug prices for Medicare beneficiaries. And it's not every day that we have the kind of consensus that we had in this committee on this issue, but we're encouraged by that. As you know, the legislation would lower drug prices for seniors, would lower drug prices for Medicare and Medicaid, and require drug companies to publicly justify the prices for their products in a day and age when we're trying to find ways to save money with respect to pharmaceutical costs and other healthcare costs in ways that are humane to people. I think this is a very good effort, and we're proud of it. Let me just ask, do you and the President support the Finance Committee's bipartisan bill to reduce drug prices?
We've been very active in working with the bipartisan leadership of this committee to try to advance this legislation. If we want to get this or some other comparable bipartisan package through, we need to do this. This is certainly one that fits the bill. If there are other approaches that we need to take to try to get this to the floor and get it passed, we're open to that. But we've been very deeply engaged with the Democrats and Republicans on this committee to advance the Grassley-Wyden legislation.
Thank you. Some of our Republican colleagues believe that the finance bill would amount to price controls in the pharmaceutical industry and jeopardize innovation for new therapies. And as a former CEO, a native, I think, of Salisbury, Maryland, but as a former CEO of a major drug company, do you agree with these concerns? And the second half of that question would be, do you think drug companies can continue to innovate under the Finance Committee's bill?
With all respect, I fundamentally disagree with the notion that the inflation penalty provisions that are in the Grassley-Wyden bill constitute price caps or price controls. These are reasonable restrictions on price increases that create basically a financial disincentive to the year-after-year price increases that we see. And as long as those incentives are in the system, we will continue to see year-after-year price increases, and the Grassley-Wyden package would contain that. It's important to remember, these drug companies already sign contracts with the middlemen with long-term price predictability guarantees. So this is not an alien concept to the drug companies. This exists as a commercial practice already. We would just get the benefit for our seniors and our taxpayers through this program. And I'm sorry, Senator, there was a second part of your question. I want to make sure I get that.
Yeah.
Senator Carper, before you repeat that second question without taking time away from you, wouldn't another way of saying it, since we pay $138 billion of taxpayers' money for Medicare drugs, that we would be just capping the subsidy that we give to give to pharmaceutical companies?
Well, it does, and that's one of the really important innovations of the Grassley-Wyden packages. It actually changes the dynamic. Right now, interestingly, the middlemen who run these drug plants have every incentive actually for the drug companies to jack up their list price because it races the senior to what's called the catastrophic phase, where the government pays most of the cost of that insurance through the reinsurance. This would be fixed by Grassley-Wyden.
Thanks, Mr. Chairman. The second half of my question, I don't think you got to it, was do you think drug companies can continue to innovate under the Finance Committee's bill?
Oh, absolutely. The changes here still leave plenty of room for profit margin, innovation, and investment. There would be no material impact in any way to the R&D enterprise in the United States, which we are all committed to.
All right. My colleagues hear me quote from time to time Matthew 25, which goes something like this: when I was hungry, did you feed me? When I was naked, did you clothe me? When I was thirsty, did you give me to drink? Doesn't say anything about when I desperately needed pharmaceuticals that saved my life. Doesn't say anything, did you provide that? But I think the intent is clear. And sadly, with respect to the President's budget, the answer to these questions is not entirely, but too often, no. Over 100 million Americans have, as you heard, as you know, over 100 million of our fellow Americans have pre-existing conditions. These folks depend on the Affordable Care Act's protections for their health care and the promise of affordable health insurance regardless of their health conditions. The President has doubled down, though, on the Texas lawsuit against the ACA, and this budget contains no plans, as far as I can tell, to replace the ACA if the court strikes down the law, which will leave millions of additional Americans stranded without health insurance, Medicaid, and high prescription drug costs, all while cutting taxes for the wealthiest among us. My question, Mr. Secretary, how will the President protect Americans with pre-existing conditions if the ACA is struck down in the courts?
So the President has been very clear that he will never sign legislation that would replace the Affordable Care Act if it does not have adequate protections for those with pre-existing conditions. It's important to remember, though, that even under the ACA, there is a statement of protecting against pre-existing conditions. But let's say you're a two-person family making $70,000 a year in Missouri. You're going to pay over $30,000 a year for premium, and you're going to have over $10,000 in out-of-pocket. So I do think we have to not over-glamorize the current situation in terms of the protection of those with pre-existing conditions, because for those people, that insurance card is, in some respects, a meaningless protection for pre-ex conditions. And we want to work with Congress if there's the opportunity to replace it with something that really would work for people.
My time is expiring. Let me just conclude with this quick comment, if I could. My understanding, if the ACA is struck down in the courts, the President won't have to sign anything. That'll be it. And I want us to keep our minds and our eyes on that. Thank you.